Are you ready to find out all about being a nurse, children? We found out yesterday about the important job of being a doctor, and today we're going to find out all about being a nurse. That's another very important job. So I have a book here and it says nurse. That's what the book is called. It's a factual book. That means it's full of facts. It's going to tell us all about the real life job of being a nurse. That lady there, she is a nurse, and we're going to find out what she does in her job. It's a very important job. So there she is. She's not wearing normal clothes. She was wearing a uniform. So let's find out all about being a nurse. Someone else who always helps us. Okay, so because it's a factual book, it's got lots of writing here. It's got a contents page. That means it tells us what every page has got on it. So we can find out all about this lovely lady here who is a nurse. Now remember, boys or girls can be nurses. Boys or girls can be doctors, okay? So you can maybe decide one day you would like to be a nurse. This lady did. Her name is Dominique. She says, I am a nurse and I work in a children's hospital. There she is. It is my job to look after children and help them get better. Oh, what a lovely job. She has to look after them and help them get better in the children's hospital. I work long hours and sometimes through the night as the children need caring for all of the time. So she works really hard as a nurse. There she is with her uniform on. Some children have appointments to come to hospital and some come as emergencies. We used that word the other week with firefighters. They rush to emergencies. Sometimes people get poorly really quickly and then it becomes an emergency to help them to get better. So they have to get to the hospital really quickly to help save them. This means every day can be very different for a nurse's job. There's lots of people who work in hospital, lots of people. There's the nurse, there's a doctor, there's someone who works in the office side to do all the filing. There's lots of different jobs. I usually start work at 7:30 in the morning. That's early, isn't it? And I meet the nurse in charge. She has to tell me all about the patients who are on the ward and let me know if there's any problems. Now, here she's telling you all about her uniform. I wear a dark blue uniform. I wear blue trousers and a blue top, which is called a tunic, so a longish top. Now we've got some labels on here. This is a fob watch. You see, that's a watch. She calls it a fob watch. So she can, we'll find out about that in a minute. She has a fob watch. I use my watch to tell the time. I use it when taking a patient's pulse too. So she has to listen to how many beats of the pulse of the blood going through your body. Very clever. She also has a stethoscope. Sometimes I use a stethoscope to listen to a patient's lungs. She listens to the breathing, make sure they're breathing okay, no crackles. She has a name badge. This lets people know who I am. That's her name badge. We made doctors' name badges yesterday. Do you remember? And I also have some hand sanitizer. Ooh, we know all about that at the moment, don't we? Because of coronavirus. We don't want germs to pass to each other, so this helps keep her hands clean. If she can't get to the sink, she will rub the hand sanitizer all over her hands to get rid of any germs. So this nurse, she puts on an apron. Sometimes we put aprons on in nursery, don't we? But this is when she puts an apron on to stop any germs coming off her clothes onto the patients. It's time to visit the children on the children's ward with the doctor. So the nurse and the doctor work very closely together to help make our poorly patients better. The baby here is called Holly, and she is only 5 months old. She's a little baby and she's having trouble breathing. Dr. Monaghan listens to Holly's breathing using, do you remember what that was called? Got it in his ears, puts the cold bit on the baby's chest. It's called the stethoscope, that's right. He writes in Holly's patient notes and tells me what medicine Holly needs. So the doctor tells the nurse what medicine to give. I need to keep checking Holly until her breathing is back to normal. So she's got a very important job to keep checking on that little baby. Next I go to Halima. She's 5 years old, a little bit older than you nursery children. I check her eyes by shining a light into them. This lets me know whether her brain is working as it should. So look, she's got a torch there. Shine it into the eyes, make sure everything's working okay. Medicine. Next it's time to give some medicine to the children. I wash my hands before I touch any medicine. Look how she's washing her hands. Oh, we wash our hands very well in the nursery, don't we? I get the medicine ready with another nurse called Asma. Another nurse always checks the type of amount of medicine for each patient, just so it's the right amount. It's always good to double check. That's what the other nurse is doing. This baby is Ishmael. He's been sick and he needs some medicine to make him better. Because he's so young, his medicine goes into his tummy through a tube in his nose. So look closely at that picture. Can you see? So she's got a syringe there. I've shown you pictures on our sway today of a syringe. And this is baby Alice. Poor baby Alice. Can you see her? She needs to have her medicine go through a tube in her arm. She places the syringe of medicine into the end of the tube and slowly gives her the medicine. So there's the syringe. Can you see that picture? There. And she's squeezing the liquid through, the medicine through. It'll go through the tube and into her arm and hopefully make her better. That's what the nurse does. In the children's hospital, there is a playroom. Wow. And this nurse actually spends some of her time in the ward playroom where she can play and keeps the children happy. And it's quite important to keep them happy. When they're unwell, they get better sooner, hopefully. This is a play specialist. This is Hayley, and she also works with the nurse. She plays with the children to help them feel better. And they're talking to the patients, asking them how they feel. Because sometimes if you're in hospital, it's a little bit scary because it's not your home and it's not your bedroom, so it's all a bit different. But if you've got a playroom to play in, it makes it all a bit more exciting and fun. So, and that nurse there is making her feel happy by chatting to her, asking her if she wants some music on, and things like that. Ooh, now, next I chat with Dr. Charlie about a patient called Bobby. Her x-ray shows she's got broken bones where she fell on her arm. Bobby will need a plaster cast on her broken arm. So this is the little girl here. She's broken her arm and it needs a big, strong, hard plaster cast on it. That's more than the soft bandage. It's a hard one. It keeps all the bones in place, makes them all fit back together. And that's how she gets better. The nurse talks really nicely to that little girl and says, a plaster cast will help your arm get better. Just reassure her. Nurse Paul will put Bobby's plaster cast on. So this is another nurse. He's got a different kind of tunic on. And he's going to put the plaster cast on. First, he puts a support bandage around it, which is a soft bandage. It's not too soft, it's tighter, but it's not the hard one yet. Then he puts a special plaster on top of the bandage, and Bobby chooses a bandage with hearts on it to go on top of the plaster. So once the plaster's on, it's hard, and then she's got a nice heart one over the top. Nearly finished, Bobby, says the lovely nurse there. Oh, then it's lunchtime on the ward. The catering staff, that's all the cooks, the people who've cooked it, not people who deliver it at least, the waiters and the waitresses come along, and they bring the food on a trolley, ready to give each patient their lunch. I take a tray of lunch to Mia Lou. That's Mia Lou down there. Aww. Some of the children have illnesses that are infectious. Do you know what that means? That means they might be contagious. You might be able to catch them, okay? So that means we need to stay away from these ones while they get better. We don't want to catch it off them. This means they can't be near other patients. A bit like we all know that we've got the germs to stay away from at the moment. We're trying to keep safe from coronavirus germs. And that's contagious. That means people can catch it. As long as we keep washing our hands and wearing our masks and things, we should be okay, hopefully. But that's why if there's any other things that are contagious, like chickenpox, sometimes we say, oh, we better stay away from that patient. And it looks like this little girl has got a room all to herself because she needs to be away from the other patients while she has this infectious disease. Children who are too ill to chew and swallow food, they have a special tube, and their food goes in a special tube up here. Goes whee all the way down into this little girl's tummy. The nurse has to keep checking it. That's her important job as well. Also, the nurse will help patients to walk. Sometimes they need a nurse to help them to walk and to get their legs strong again. And at the end of the day, it's been a busy day for our nurse, Dominique, but there is still some work to do before she can go home. She has to write up all her notes on the children that she has seen today. Then she checks her emails on her computer, so she has to do some writing and checking on the computer for emails, checking that she's got all the information ready to pass on. Before I go, I give all my information about all the patients I've seen to the next nurse who I swap over with. I tell her about the problems or the children that might need extra help. I walk once more around the ward to check all of the children before I go home at 8:30 at night. She is such a hard-working lady. So she works with lots of people, and she says, I really enjoy being a nurse and helping all the children to feel better. What a lovely caring job. And that is the job of the nurse. Now, some nurses, they actually might not work in a hospital. They might actually work in a doctor's surgery. And that's where they might give you your flu jab, your injections, and things like that. Sometimes you might go and get yourself checked out if you've got spots and things, and they can look at your spots. Sometimes you might have something in your eye or your ear, and they might be able to look at those things as well and help get you better. So that's what a nurse could do if she doesn't work in a hospital. And some nurses actually come in their cars. They come to houses and homes, and those patients who can't get out of their house for some reason, they will come into your home and help make you better in your home, which is a lovely thing to do as well. So they will help in any way they can. And that is the job of the nurse. Whoa, what a lovely caring job it is. And we all should say thank you to our nurses and our doctors at the moment, because they're working especially hard. So do you think you would like to be a nurse when you're older? That would be nice. If you work hard, you can become a nurse or a doctor, like I said yesterday. So talk to your grown-ups about what you would like to be when you're grown up. Would you like to be a nurse, a doctor, a firefighter, a teacher even? Well, you can choose. You've got a long time till you're grown up, so you can have a good think. But at least you now know what the nurse job is all about, and the doctor. Okay, so talk to your grown-ups. See what you want to be. Talk to them about what you want to be.